Friday, 20th March. I'm going to the Palais des Nations for a press briefing, telling the world about why the funding cut could have devastating consequences for the health of millions of refugees around the world, including children. Yes, we're in a crisis situation, but there are also opportunities for us to stand for humanity. I'm here to talk about a very worrying situation with close to 13 million displaced people, including over 6 million children at risk of not being able to access life-saving health and nutrition care and having devastating consequences in 2025. The current funding situation, complicated by declining health expenditure at country level, is affecting the scope and quality of public health and nutrition programming that we're able to provide for refugees and host communities around the world. The result is that we are seeing a disruption in access to essential services, an increasing risk of disease outbreaks, of malnutrition and lack of treatment of chronic diseases. We're also seeing a rise in mental health issues as a result of this funding situation. Just to note that when the funding cut is reduced for the refugee health care, it's also affecting the host communities around there. And refugees themselves are facing increased barriers, including being able to pay from their pocket. Right now, the situation is forcing many of them to have to pay more with funding that they do not have. As a result of these funding cuts, it's not just affecting health, but it's also affecting water supply systems. It's affecting sanitation facilities, waste management. And this is associated, as we know, with increasing risk of outbreaks of infectious diseases like cholera, hepatitis, malaria, and others. And it's threatening populations around the world with devastating consequences. I hope we delivered the message. And and we really hope eventually it results in support to the work that we do. We need the resources, we need the money to be able to support the refugees.